Hi, in this video I want to show you how to stop hiccups fast. Now for most people this isn't a major health issue, but they're incredibly annoying if you've ever had them. I personally have one technique that for the last 30 plus years of my life has worked 100% of the time for myself and anyone that I've ever told to do it, that I've actually watched do this without fail. Hopefully it can help you. Alright, so let's find out what this is. Hiccups. First of all, how does this occur? What is it? All right, well, normally we breathe and our diaphragm contracts, okay, and it allows air to expand into the lungs in a normal controlled fashion, about 12 breaths per minute. Now, whatever can cause a sudden increase in that abdominal pressure or a sudden contraction of the diaphragm can cause the air to come in unexpectedly in excessive amounts, and it slams up against our vocal cords and causes that hic sound, and that's the annoyance. And all of a sudden this muscle contraction or spasm or reflex continues to occur. We keep getting these hiccups and it's annoying. So what do we do about it? All right, well, first of all, the causes in most cases we would find would be swallowing air. So not breathing air, but swallowing it, getting it into the wrong tubes, carbonated beverages, all that burping, belching, but the air disturbance, excitement, sudden stresses, things like that. Eating too much or too quickly, because obviously we know that's not great, but we often swallow air as we're doing this. Sudden temperature changes to the stomach. So maybe drinking a really cold beverage, hot day, cold beverage, and it slams against that stomach, causes the muscles to contract, not just of the stomach, but around the diaphragm as well. Alcohol and smoking. Alcohol is a depressant, smoking's a stimulant, so those can affect the muscles of our body. Anxiety, definitely, for chronic issues especially. If a person's anxious, they're holding their breath often, and those muscles are contracted, and the body's trying to get air in, and it might have a contractive effect in the diaphragm. Gastrointestinal issues, acid reflux, bloating, heartburn, affects all the different tissues of the chest cavity, most especially in the throat area, but that can affect things dramatically. Ultimately, anything that affects the vagus nerve, that's the cranial nerve number 10, that basically is telling many of the muscles of the diaphragm, the respiratory system, all the breathing muscles and the digestive muscles what to do. So if they get disturbed in any way, it's going to cause this disturbance. All right, so what do we do? Well, drinking water is great, but in this case, we're not going to drink the normal glass of water like most people think. And a lot of people have seen this technique done or they've heard of it, but they've never actually personally used it. They just say, all right, well, it may be a good idea. But I've seen 100% of the time, over 30 plus years, it works. Try this. So instead of drinking out of the front of the glass, a cold glass of water, so you get that increased cold hitting the stomach, fill it up to the top, or I'm going to do it to the this port so you can see it without me spilling all over myself. But you drink out of the opposite side, so not the thumb side, but the opposite side where your fingers are. So if you were to lean over a sink, especially in case you were going to spill some, and drink out of that, what it does is it causes you to breathe differently. It causes you to contract your abdominal muscles differently, and all that respiratory and contraction change will almost instantly. I'd say almost 90+% of the time on the first sip or two that occurs. If not, I may have to go back for a second time and it goes away. So I would say please try this if you have them. I actually get excited when people have the hiccups because I look forward to them trying it and having another person have a successful event with it. So give it a try. Hopefully you don't get them much, but if you do, look forward to seeing how this is effective, and leave some comments below to let us know if it's worked for you in the past or if you have some other tremendous approach to doing this. So thanks for watching. We'll see you in a future video. Have a great day.